for a couple of other of our presenters, and we'll get started in 1 minute. Thank you. Okay, welcome everyone. We won't keep you waiting much longer. Thank you for joining us today as we launch this report and have a really exciting panel lined up to discuss some of the kind of implications, recommendations, and findings that we've had. So as you all know, so this report was published in December last year and was worked on by Beyond Group Consulting, which we're happy to have with us here today. And it looked at achieving resilience by linking humanitarian CVA to social protection in the MENA region. And for those of you who don't know me, I'm Rana Nassar. I'm the regional representative for CALP in the MENA network, in the MENA CALP network, sorry, and really happy to have you all with us. So just a quick outline for today's session. So it will be for an hour and a half. The session is being recorded. If I just ask my colleague Sarah to double check that's happening, please. So for anyone who missed it, we will be posting the recording on our website. So we'll start with a quick presentation from Beyond Group. So it's Abdullah who's joining us today. And then we'll go on to a panel discussion, which will be started by some opening remarks by Massimo, who I will introduce shortly. And then we'll go into some Q&A. Hopefully we'll have time for that towards the end. There is a Q&A box, so please feel free to utilize that. And we will be fielding questions, or the presenters can look at the box and answer them as we go along. So yes, first of all, without any more delay, I'm really happy to introduce Abdullah Tajwer, who's a senior consultant at Beyond Group Consulting, who will be taking us through just a quick 10 minutes on the main findings and recommendations of the report. Abdullah, do you want me to share the presentation, or will you be doing that?
Rana, go ahead. It's fine. I can manage.
Over to you then.
Okay, I'm saying that you can go ahead and present it. I'll just start.
Sure. Just tell me when to click through.
Absolutely. Okay, great. Since my 10 minutes are officially starting right now, I will try and stay within the time limit. Thank you for this opportunity to CALP. I'm Abdullah Tajwer, a senior consultant at Beyond Group, and I'm delighted to have contributed towards the development of this report, this feasibility study rather, on assessing the feasibility of linking humanitarian CVA to social protection in the MENA region. The three countries that we focused on, considering the scope of this project, we looked at Iraq, we looked at Libya, and we looked at Yemen. And Rana, if you could go to the next slide. And I will just use these 10 minutes to quickly go over how we analyzed the information that we got, both from key informants as well as from the existing literature that existed on these three countries with respect to the subject matter. Then quickly and very briefly go into the key findings and the recommendations. I'll try to be as brief as possible because there is a lot of detail that exists within the report as well. So I encourage all of you to also have a thorough read of it as well. I'll try to be as high level as possible in the interest of time, and we'll be happy to answer questions as well as we move along in the webinar. Diving straight into the analysis framework. So essentially the information that we got on these three countries, we wanted to meaningfully come to a conclusion on what on how feasible linking CVA to SP would be within these three countries. And the analysis framework that we essentially developed for this study was that we looked at three levels. We looked at the political level, where we essentially assessed the readiness of the government, as well as its capacity to develop these linkages. We looked at the technical level, where we tried to evaluate the alignment, as well as the capacity of the cash and voucher assistance processes and tools, as well as critically looked at how that can be integrated within state social protection systems, or how the state SP systems can benefit from this wealth of knowledge and technical expertise that exists within humanitarian CVA actors. And lastly, at the operational level, we wanted to also assess what is the existing state of coordination, both within a certain set of stakeholders as well as across stakeholders between the government and the non-governmental space within these three countries. And on the basis of that, if you could quickly go to the next slide, Rana, thank you. And these are, of course, broad findings attesting to where each country is and how that plays into the conversation, or at least into the answer of the question on how feasible this linkage is. So in the case of Iraq, we found it to be more of a favorable environment, considering its context in a post-conflict state. It's also transitioning from a humanitarian architecture towards a more sustainable development cooperation framework. There is more of a maturity within the system as well, more of a technical expertise, more of a harmonization and coordination that already exists within the system that makes this conversation more favorable in the context of Iraq. In Libya, we found it to be more challenging, considering, of course, the current state of the country, the political and the operational challenges that do exist as a result of that, as well as the limited level of meaningful engagement between actors on the humanitarian side and their government counterparts, where we felt that this is putting more of a restriction on the possibility of having these meaningful conversations on linking these two systems together. In the case of Yemen, perhaps out of those three, it comes at the end because of the fact that it continues to find itself within this fragmented political landscape. You have two separate governments within Aden and Sana'a. And there is also this lack of willingness from the state to meaningfully want to reform its social protection systems as well, which has led to there being all sorts of approaches to both CVA as well as to also do social protection. And so that as a case feels, based on the evidence that we looked at, the least favorable. On to the next slide, where we can talk in high level detail about each country. In the case of Iraq, we essentially have summarized this to three main supporting factors and three main challenges to achieving this linkage. In the case of Iraq, of course, I'll talk with the challenges first. And the challenges in this case are with respect to there still being some operational inefficiencies that exist within the system. And it's mostly to do with the fact that although the system has advanced considerably, there are still some things with respect to how the government is taking on its role to meaningfully engage with the remaining actors to try and develop these linkages with cash and voucher assistance. The second main challenge is also tied to this broader conversation on the fact that in this transitionary phase, there is a lack of clarity. There is a lack of a guiding vision, rather, which lends itself to a lack of clarity in terms of, okay, this set of factors, what exactly is the role that we're playing? And in addition to that, there are some gaps as well. There have been instances of forums and platforms that want to address this question, but they haven't met regularly. There hasn't been that sort of emphasis or an impetus put on them to be able to effectively have this conversation. And of course, lastly, in terms of uh, this point, I think I would want to emphasize more on the fact that within the cases that still are receiving social protection from the state, there is this trust deficit as well, which I feel can be used as a benefit, used as an opportunity to have this conversation on linkages, a deficit in terms of not trusting the state's social protection system, issues on bias, issues on inclusion errors, cases of there being bias towards some communities, bias against some communities. If I talk about the supporting factors, of course, the government is relatively stable. It's classified as an upper middle income country. It is showing more of a responsibility in terms of its fiscal approach and is trying to actively engage as well with stakeholders. There is also these two supporting factors, which are more or less linked with each other because in the current state right now, within the Sustainable Development Cooperation Framework, you have existing mechanisms as well where this conversation can happen. You have the area-based development, area-based coordination groups that still exist, which can be used as a potential platform to advance these conversations. You have those complex cases that still exist as well, where the humanitarian actors still have a role to play, where they can engage with the government to sort of try and bring them into the overall statement. So there are these existing initiatives that are still in place that can be used as a platform to advance this conversation. Moving quickly to Libya, which is in the next slide. Um, so very briefly, in terms of supporting factors, although there is, I would want to treat these as cautious optimism, but there is seemingly an intent to reform the system as well. There are some programs that are happening with some donors and international agencies to try and reform the state social system despite the challenges. There is also a willingness from the government as well to also try and look at ways whereby they can formalize the labor that is coming into Libya, look at strategies whereby they can sort of try and regularize them and bring them into some sort of a safety net as well. These are signs that are in the nascent stages, but I guess time will tell how this situation evolves in Libya as well. But there are some optimistic signs. The challenges, of course, are still there and are very much existence. There is no unified strategy. There are real budgetary constraints. The system is operating in silos. There are different ministries running their own programs that tend to not speak with each other. There is also a perception problem as well, which we wanted to highlight, where there is this perception that the international NGOs operating in the country have another agenda, let's put it delicately. And there is this trust deficit that does exist. And in addition to that, there are the usual problems of there not being sufficient beneficiary data. There are no adequate monitoring and evaluation systems set in place to really assess the efficacy of the existing programs. So the system itself is not well oiled, so to speak. Moving quickly to the case of Yemen. Yes. A positive sign, of course, in the conversations that we had for this was that, yes, there is, despite the situation, at the implementation level, there is a relative level of autonomy that exists for the existing social protection programs within Yemen. So even though the system might, as an outsider, look like it's collapsing, but it's still working in some shape or form. And that is a sign for optimism. With respect to the current state, there are humanitarian actors that are already on the ground that are expressing the need to actually harmonize uh, cash and voucher assistance. So the system itself is not harmonized like it would be in Iraq, like it was in Iraq. But there is this intent to at least reach that aspired state, whereby at least there is one system, the humanitarian system is at least well-oiled, it's well coordinated. And if that happens, that can serve as the basis for a conversation with the state. But in terms of challenges, there are very real ones as well. There is, as of yet, no unified national strategy. How could there be, considering that there are two different governments with which all entities are trying to find their own ways to navigate? There are, of course, resource constraints because of the situation in the country. The coordination that is even happening, and this is tying to the first point, is a bit unstructured. And to sum it all off, the beneficiary lists haven't been updated in years. There is no centralized database. Civic documentation is a very real challenge, and that, of course, impedes the aid that vulnerable populations can get in the current state, but even that may be an impediment for the future as well. And so perhaps if an emphasis happens on this issue, that can also serve as a good linking point to have this conversation on how these two systems can be linked. And these are, of course, very high level, and my apologies for trying to quickly go over them. We'll now jump into recommendations very quickly, and Rana, perhaps the last slide might be a bit better for this, considering the time. Yes. So if we look at the case of Iraq in this case, the recommendations that we developed as a result of looking at all of this evidence base was that uh, there is this space that still exists to prioritize an early engagement with the government, to develop multi-stakeholder cooperation, referral systems, and to meaningfully develop a program on how the government's capacity can be built and where it should be built. A good approach can also be to actually engage with the government in finding digital solutions that are also aligned with the government's interest, which can enable the which can lead to an improvement in data management and coordination. So perhaps that can be a support that can be provided to the government that can that can serve to link these two systems as well. And lastly, is basically to strengthen the government's capacity by reviewing the existing processes, by recommending new processes, by actually doing the work of knowledge sharing and creating that space whereby the actors that still remain within Iraq can actually assist the government in increasing its coverage, in making it better, in removing that trust deficit, and to make it more all-encompassing, whereby it can tackle those complex or those marginal or residual cases as well. In the case of Libya, the recommendations should be taken, a more judicious approach should be adopted. I'll rephrase. And by judicious, yes, you can have it in phases as well. Perhaps the first part of that conversation should not be on putting any pressure or any entity, but it can be to perhaps talk about where are those instances where we can at least start to share knowledge, where we can start to collaborate, where we can actually uh, talk about the things that the government is perhaps thinking of leaning towards. So if it's about the regularization of migrant labor, perhaps that can be a point where the humanitarian actors can start advocating for their inclusion, and perhaps that can be a stepping stone for talking about how they can be incorporated into a broader social safety net, if that can happen. Um, and certainly, the other part of this coin can be on focusing efforts on developing crisis responsive safety nets in cash assistance to basically advocate for the incorporation of these shock responsive safety nets in Libya's existing cash assistance framework. To recognize the importance of adaptability in the face of potential crisis, and to use that as a competitive advantage of the humanitarian side to assist the Libyan government. And perhaps gradually, as things evolve in that country, we can better understand how that conversation on linking these two systems will proceed. And lastly, if I look at the case of Yemen, there are several steps that can happen. And perhaps the case of Iraq can be used as a good example for the case of Yemen as well, whereby your existing coordination mechanisms can be strengthened. There can be more of a role that is played by these stakeholder platforms to actually get all the actors on one side of this conversation, at least on the humanitarian side, to start developing these minimum standards, to start developing these common processes and common tools, and to also overcome this hurdle of data privacy and to meaningfully engage with it, to talk about, okay, how we can share beneficiary lists that we have, how can we sort of essentially play off of the advantage of each other to incorporate as much of the population as possible. And I think if that house is put in order, that can at least help in the conversations with the state that happen later on as well. And lastly, I think as a good tool or as a good approach or as a good low-hanging fruit, if you will, if the civil documentation challenges can also be looked at. And in that, you can the humanitarian and development actors can certainly support local authorities and the existing social protection programs. STF comes to mind to sort of, at least if they can start overcoming this challenge, that can also at least enable the collection of all of the beneficiary data to make a repository as well. That can certainly assist if once the government's willingness starts to become more apparent, that can also be used uh, as a good practice that can be shared with the government as well. And it can certainly assist them in building their capacity in any future conversations on having a well-oiled social protection system that is linked to all the lessons and all the knowledge that exists within humanitarian programming as well with respect to cash and budget assistance. I apologize if I went a bit over, Rana. These are very high level. I would encourage everyone to also go over the entire report as well, where we talk about all of these in more detail. I will be quiet now, and thank you so much for allowing me this time.
Thank you very much, Abdullah, and yeah, thank you for doing this in such a short time. But yeah, again, I do encourage everyone to dive into the report for more details, and again, feel free to ask your questions in the chat. So now we're very excited to present our panel for today. So we have Massimo La Rosa joining us from DG ECHO, so he's the regional lead on forced displacement and social safety nets, and he's been based in the regional DG ECHO office in Amman since 2018. We have Justine, who's the Regional Economic Recovery Advisor with the Danish Refugee Council, and Justine is also based in Amman. And we have, again, just from a regional / global perspective, we have Jewel Pinkston joining us from the World Bank. So Jewel is an economist with the Social Protection and Jobs Global Practice, and he's focusing on Egypt and Yemen. So really glad to have you three with us today. And then, of course, our in-country experts from the 3 countries that the report was looking at. So we have Wissam, who's the Deputy Management Director at the Social Fund for Development in Yemen. We have Mauro, who's the Cash and Markets Working Group Coordinator in Libya, working with UNHCR. And we have Igor, who's the Chief Technical Advisor with ILO in Iraq. So welcome to all our panelists. We're really happy to have you here and look forward to hearing your reflections. And with that, I will hand over to Mireia, who will be moderating this panel. So Mireia is the regional cash CAP expert in the MENA region, and among other things, chairs the MENA social protection linkages to Humanitarian CVA community of practice, which CALP hosts. So Mireia, over to you.
Thank you, Rana, and welcome everybody to this webinar. So to kick off with the contributions and reflections from all the panelists, we wanted to start hearing from Massimo La Rosa. So welcome, Massimo, to this panel discussion. The first question that we would like to ask you is that from your experience that you have across the MENA region, if you can tell us a little bit, what do you think that how we can work towards aligning humanitarian mandates, donor strategies and programs with social protection actors and governments to enhance the linkages between humanitarian cash and social protection?
Thank you, Mireia. Good afternoon, everybody. And thank you very much for inviting me and DG ECHO. It's always nice to know that CALP is actively involved for this kind of dialogue and to learn in public events. If I may, I would like to, your question is quite complex. I will try to do one step back and hopefully 2 forwards, starting with what I consider has been in the region and at global level as well, some of the major milestones in the progress made through the policy development, some reference. But most of the time, I would like to use it mainly to discuss with you which are currently the barriers. In my opinion, focusing on which are the barriers today can and should help us more to understand why, for instance, even with good progress, there are still some bottlenecks and challenges in something that sounds quite clear and rational for those that are working full-time on this topic, from the humanitarian cash assistance and from the social protection side. But de facto, we know that it's not possible to implement as we would this kind of program everywhere. So the first point that I would like to make is on the policy framework. Let me just list 4, and that doesn't take too long. major changes, and clearly I will start with the key word of the humanitarian development and peace nexus. The operationalization of the nexus and the linkages between cash humanitarian transfer and social protection, it's a perfect marriage by the definition of what nexus is. Which were some of the major elements that help us to progress in some of the countries. I would say add one in particular, that is the involvement of the peace and political analysis on top of the technical issues. Often between humanitarian and development, we discuss how technically sound is a program, but we need also to see at a certain point, especially in protracted crisis, how is financially sustainable and politically acceptable from the development side. And I think this is something that bring within the Nexus discussion, the humanitarian around the same table with development colleagues of the international community, and in some circumstances directly also with the government that are hosting a social protection system in place. The other key element in which I really believe that we could do even better in the future is the localization file with local actors. Local actors are not only civil society organizations, but potentially this boost on localization could help to expand the network of know-how, including all the different category of stakeholders of local communities, including host government at municipal and central level in a dialogue with humanitarians. And the last two, very quickly, are as we know, the big expansion in humanitarian, the cash in humanitarian. Why is important for social protection? Because we are using the same modality. Development colleagues and government, most of the time, they use cash to deliver social assistance to their citizens. And at the time that humanitarian decided to expand cash, we are talking the same language in modality terms compared to the past. But let me say the last word on the policy framework on the development side, in which I was working before joining ECO for quite some time in social protection. The expansion and the discussion of shock responsive social protection and adaptive social protection over the last, I would say, 10 years, it's bringing the objective of what the humanitarian often would like to achieve much closer to a social protection specialist. Because as we know, initially, and many years ago, most of the social protection systems were built for poverty alleviation. But when we include the concept of shock responsiveness, it means that the government and development funding, including banks, had an interest to use the flexibility of scaling up this program also for shocks, including the shocks due by conflict that unfortunately in the MENA region there are still several. I move to the second part, but which are the barriers that we still have to face? I was reading the title on the other day again of this session, and what is nice is that you associated the cash assistance linkages with the social protection. But de facto, and I would like to hear then the opinion of others, when we look at the experience that we had over the last years in the MENA region, for instance, the reality is that we are looking mainly of linkages with social assistance. The conceptual framework of social protection is much wider. So when we talk to a social protection expert from the development side, they consider social assistance as one of the options, not the only option. And maybe this was also a limitation from the analysis that we had until now. Because as you know, from a development perspective, from a government perspective, social assistance, it's a cost, and not always has been seen as an investment in human capital for those that potentially could move from that program to other programs that are much more productive in the society, like social insurance and social security. Too often, we don't have this rationale in the discussion in linkages the humanitarian system with longer-term solution. And so, another time, semantic is important. Words are important. And I think this should help us to develop even further what we are discussing. But let me be a bit provocative and before closing my intervention. In my opinion, what happens sometimes is that we have this discussion between the humanitarian cash expert and the social protection in several countries. But what is the risk that brings some limitation of this dialogue? As I said, sometimes we use the same word, but with a different definition. Sometimes we do not talk to the right interlocutors, because we should not forget that from a humanitarian side, we often talk to the international community. While from the social protection side, often the government is in the lead, and the major donors funding the government are the interlocutors if we want really to bring these linkages. In my experience in this region, but also in others, I don't see many hubs in which humanitarian, development, government, international banks are talking together around the same table. How can we bring linkages if we don't talk to each other in the same group? And this is the problem of coordination that often is still separated and not conducive for solutions. And the third point is that sometimes when we speak, it's too late. And too late not only for the people that unfortunately they will have some hiccups in the sequence of programming, but the hiccups are also sometimes in the way how we should look at the other word that was also in the title of your very good publication and your key recommendation. You use the word resilience at the end. But resilience, what does it mean when we talk about linkages cash with social protection? In my personal opinion, resilience is linked to solutions for the people to depend less from humanitarian for sure, and often less from social assistance as well. And that means that probably the final solution for many in many countries is about policy reforms and entitlements for the citizens and the people that are hosted, including the refugees. I think sometimes we have our dialogue between humanitarian development, as I said, only on the first step and not on the others. And even as humanitarian, we don't deal that on the long term on social protection. Doesn't mean that we should not be involved in the know-how and learning, because probably social protection experts know much better how systems are working, and the humanitarian probably know better the needs of the population and how to transition from A to B needs both brains going together. And this is also linked to the other word that we use more and more often, that is transition. What transition means and to what is the end of the transition? Is it a change of a budget line from short term to long term? Or is it the transition of the people in a dignified life? And I think this is the very last of my point. So just to conclude and wrap up from my side, I don't want to sound too critical with the crowd in which I belong, that is the humanitarian. But in my opinion, we as humanitarian should not think that we know all the solutions, when sometimes we are the first to support the people, and is rightly so. But at a certain point, we should not have the expectations that development and the government will decide to fully fund what we were funding on the short term. We should assume from the beginning that they have maybe different interests, and we need at a certain point, hopefully from the very beginning, to understand what could be a reasonable package for the people in need from the beginning to the medium and longer term. I don't see this discussion happening when we start the crisis. Thank you very much, and happy to contribute with the Q&A. Over.
Thank you so much, Massimo, for your insights and all the valuable points that you just shared with us. We will continue now with Justine from DRC. As DRC is working and exploring on this theme on social protection very closely here in the region. So we wanted to ask Justine, what do you think are the roles that can be taken by different organizations or stakeholders in creating such linkages between cash and social protection?
Well, first of all, thank you so much for inviting DRC to that forum. So thank you so much. And I'm really glad to hear your point, Massimo, because I'm going to echo a lot of those points, in particular related to the partnership between development and humanitarian as well as looking at social protection from a holistic perspective, not only from the social assistance pillar, but from all the different pillars that need to interact together. So definitely, as the CALP report showed, national, international NGOs, donor, private sector, and governments have interrelated roles in social protection. And not only actors do have interrelated roles, but also, as Massimo also mentioned, all the social protection pillars themselves are interrelated. And we really can't talk about linking CVA to social protection without thinking about all the linkages to the labor market, to the social insurance, on how social welfare services are intrinsically linked with social assistance, for instance, etc. So approaching social protection from a system perspective is a core part as well of a do no harm approach, and that needs that system perspective. I will really not want to reiterate in detail what the report says in terms of the roles of the various stakeholders, but I would rather like to reemphasize, as Massimo did already, that more dialogue and partnership needs to happen between humanitarian and development actors, and that jointly we can promote social protection policies and practices that are effective, inclusive, and sustainable. So from a system perspective, to answer your question, Miria, all these actors and all these pillars have to interact as a whole. On the government front, first, they definitely have the primary responsibility for ensuring social protection for their citizens through social protection policy formulation and implementation. And what I really like about the CALP report is that it highlights very well that the social protection is rooted in the social contract between citizens and the state. And that's very true. But social protection is a human right, so that means it needs to be universal. And not only talking about citizens, but talking about residents. So having this concept of residents rather than citizens. So that means including obviously all kinds of citizens, including internally displaced, but also other residents, such as people seeking international protection. So we have to recognize, though, that obviously the inclusion of refugees in social protection system can be quite challenging for governments. It's quite challenging to extend in one go the system to all, to then be able to respond while the system itself is already strained most of the time. So that's here that I see critical role between donor governments and NGOs and CSO to collaborate, of course, with host governments, but to respond faster to the needs. And that needs to be done in a system that aligns as much as possible with the national one. Again, not to cause any harm. But that's very true in a refugee kind of context. But when we're talking about contexts such as, for example, Yemen, where the conflict is leading to internal displacement, most of the time also it's that the system itself has been damaged. So we can also wonder how can or would the host government be able to fulfill its role in that case? And that's very challenging in particular for internally displaced population or citizens, but do not have sometimes the same right or have limited access to social protection. So that's the role of governments. Specifically, again, as a system perspective, the role of NGOs. First of all, I do believe it's, from our perspective, to have the basic minimum awareness of existing social protection system to, again, avoid causing harm. We also have a role as NGOs in social protection system as a temporary substitute. We are just here temporarily. We're a substitute in the absence of functioning governmental social protection. And that should, again, be much broader than social assistance. Our role is also on labor market inclusion, social insurance, social welfare services. For the case of civil society, I think their role can be understood in a much kind of longer term. It's really linking people to system at a grassroots level, but also raising awareness to the population about their rights. Again, going back to the fact that social protection is a human right. So in this kind of broken or partially functional system, like, for example, the 3 countries that the CALP report assessed, like NGOs and civil society, are really a catalyzer between the population and the government social protection system, and specifically, I believe, for marginalized and excluded population. So being this bridge, in fact, between the population who are excluded and marginalized and the social protection system. And that could simply go through several relatively easy elements, I want to say. First of all, it's the referrals from the humanitarian assistance to the government social protection program were functioning, obviously. Second is also contributing and influencing the targeting and the ongoing update of social registry related to poverty alleviation and protection based on field-generated evidence. And that's a point as well Massimo gave. The third one is raising awareness among the population about their rights in terms of social protection and how to access and exercise those rights. And lastly, and very practically, one role of NGOs and CSO is to support access to social protection schemes through legal aid, administrative support, financial literacy, financial inclusion. Those are practical activities we can put in place. I will give you a very concrete example. In Iraq, DRC is implementing a project funded by ECHO, together with NRC as well, where we support people in getting legal documentation and in registering, so all this administrative support as well, in registering into the SSN. While we support them at the same time with NPCA until they get that SSN support. So here it's quite interesting because this project, we are, from NGO perspective and with ECHO, tackling two of the main challenges that people face in Iraq to access social protection: the lack of civil documentation and the lack of knowledge about government procedures to access the social protection. However, and again, putting things back in the system perspective, it's very critical that the other challenges are actually being tackled by the host government, and only the host government can find a solution. For example, it's everything related to the government bureaucracy. That means that there are delays, so delaying individuals from accessing the services, but also that there is social tension and mistrust, that then some households with different background or reluctant themselves to access the social protection system. So the role of working together to tackle different kind of challenges. And lastly, on the NGOs, the critical role as well is to increase the interoperability between the cash programming and the social protection programs, but also to consider social protection as an exit strategy. And the CALP report mentioned the Cash Consortium of Yemen, which is led by DRC as well. And I think that's a good example because here, the reach and the scale of the CCY, the Cash Consortium of Yemen, allowed as well to have some reach across the country with harmonized CVA and modalities with several actors, and also trying now to look at referring recipients to longer-term social protection, for instance, with SFT, but also to imagine social protection as an exit strategy. So it's very important to put that as it is the government role. Very quickly, on another critical actor, it's the private sector. And they hold a critical role as well in simply facilitating the CVA transfer. We are here to also support, for example, if we can work a bit more with mobile network operators to extend simply the coverage of network connectivity to hard to reach areas. Also FSPs who have a role in easing and adapting the KYC processes as well. But also if we think about CVA further than only MPCA and linkages with social assistance, it's also the role of the private sector in supporting the labor market activation, in offering affordable and inclusive alternative to social insurance when it doesn't exist in the government. And my last point will be on the international organization and the donors. It is a critical role in providing, obviously, the technical assistance and expertise to the host government. And here to promote also inclusive social protection system and system strengthening. But here, really, international organizations and donors also have to recognize further, and that's not what we're really seeing all the time, but to really recognize further the role of NGOs and CSO in social protection, the role that I've just mentioned earlier, and to really integrate them in the discussion with host government. And as you mentioned, again, I'm referring to you, Massimo, because we had a bit of the same talking points, but it's very true. We need to have a dialogue all together and to consider that we are all relevant actors in very different roles. And of course, all the funding and technical assistance with international finance institutions such as the World Bank or the IMF is highly valuable. But here, I just want to acknowledge that there is a point of view of the population of the host countries and CSOs we don't necessarily appreciate the translation of this support into austerity measures, into poverty targeting, into limited engagements as well with the civil society. So yes, the role of donors and international organizations is very complex, finding this balance between funding large-scale social protection programs versus advocating toward host government to invest efficiently and sustainably in their own social protection system. But we also need to see these reforms happening in terms and support in terms of universality of the social protection system, and not only citizens, but again, looking at residents overall. Thank you very much. And sorry if I went over time.
Thank you, Justine, for your reflections. And thank you also for sharing a practical example. I think that this is very important to visualize, no? How these roles can be taken in practice. We're going to move now to the World Bank with Jules, as the World Bank is a key development actor in linking cash with social protection systems. So giving the specific country examples that we have in the report, Libya, Yemen, and Iraq, what do you think is the best way for different types of organizations and governments to collaborate or coordinate on this topic, on linking with social protection? And how can they practically identify strategies and operational actions to take forward together?
Thanks, Mireia, and thanks, CALP, for having me here. It's a pleasure. So a good way to start to collaborate and coordinate, as Massimo and Justine was saying, is from the top down. You're starting with governments when they're in place, and among major donors that finance interventions and CVA. Often, and I found this, is attempting to foster collaboration and coordination further downstream gets fraught and with operational issues on sharing data, agreeing on target populations, what data to use to reach out to those intended beneficiaries, and even assistance modalities to use. So I mean, I think it's important to have vertical alignment before there's horizontal alignment. Ideally, the government leads coordination with non-government actors and defines the modality of the support that's needed in addition to the government system. But in many countries, as well as the report mentions, that can be difficult. So it's important that we have that house in order before interventions are defined. So core aspects is, again, of intended beneficiaries, how they're identified. Assistance modalities need to be agreed up front before CVA and development actors go to the government, and so that there's a unified perspective on what can be done given the resources available. And it's important also to gain an understanding of what interventions to take forward, and in doing that, what can be done is joint needs assessments, and what platforms to use to select attending beneficiaries is important. So, for example, in the Philippines, the World Bank has worked with the government to assess the impact of natural disasters, develop social protection responses in response to that, and that's included also CVA. We also know that CVA is more effective when it's complemented by social services. I think, as Justine mentioned, this is done in Kenya, the World Bank Hunger Safety Net Program, integrated cash assistance with other social services to provide a much more comprehensive and sustainable safety net for vulnerable populations. I think it's important that organizations do their part, supporting the necessary capacity for implementing CVA within national social protection systems. Of course, includes training, technical assistance, knowledge sharing. And in Ethiopia, the Productive Safety Net Program has been supported by various development partners, of course, the bank as well, but and they've worked to support and increase the capacity of government to deliver social protection as well as social services. So broadly, what I see is we need to technically agree to collaborate, but money talks and people listen. And it's important to engage in multi-stakeholder workshops to define what you're doing and how you're going to do it. Develop also a shared understanding of the local context through joint assessments, as I mentioned, data analysis, what platforms to use, payment service providers to work with. And this it sounds obvious, but it's often this doesn't happen until later on that these sorts of discussions are happening. It's important to have coordination mechanisms. Justine mentioned CCY. There's also the Cash and Markets Working Group in Yemen. UNOCHA plays a strong role, ECHO as well. But this is, we're 9 years into the conflict in Yemen. It has taken a long time for what I see increased coordination of humanitarian aid and development. But we're getting there. Right. No. So with these coordination mechanisms in place, you can pilot approaches to response and scale those up based on evidence, right? And I think in the case of Yemen, as I mentioned, those coordination mechanisms are in place. And maybe to give a concrete example on Yemen, the World Bank in Yemen is collaborating with UNDP and the Social Fund for Development on having several of the projects under IDA using the same targeting approach, where earlier different targeting approaches, at geographic level, sub-district level, and so forth, were pursued broadly similar, but important differences therein. So there's an alignment now on the social protection and agriculture side, in where we go given the limited resources available in IDA, but also on the aid in terms of aid financing. So with this new targeting approach, it allows at least these two projects to be aligned. But the idea is to go beyond that and also look at health and education projects, but also look way beyond the bank and see how cash CVA can be aligned with that and other development actors as well. So it's an initiative we've started. We're piloting it, working with SFT and UTP on this, and importantly, as I mentioned, we're evaluating the efficacy of this methodology, and with that evidence, we can then advocate for others to follow suit. On the financing side, as I mentioned, the declining IDA in Yemen across the board is really making it so much more important to be cost effective with the limited resources. So there's an approach that was tried in Ukraine called the framework approach that allows firstly the bank to lead with IDA, but also allows for lower cost options for others to co-finance such initiatives, as I mentioned on the harmonized targeting. It's the actual name of it's called geo-bundling and continuum support. It's quite a mouthful, but we're really hopeful that it's going to make a difference in Yemen, and it can also lead to the linking of CVA and development going forward. I'll stop here.
Thank you so much, Jules, for sharing your points and also for bringing the perspective from the development side as well. We're going now to move to the country-specific panelists. Before we start this part, I would like to kindly remind if you can stick with the time allocated, otherwise we will not have time for questions and answers, and I think that this is also super important. So we're going to start now looking at Yemen with Wissam from the Social Fund and Development. So Wissam, as an actor with long years of experience in Yemen, how do you think that social protection programs can adapt to make linkages with humanitarian cash a reality? And what is the potential role of the local and national organizations in it?
Okay, thank you, and good afternoon. Well, thank you for inviting me on today. Please allow me just to maybe introduce the topic with a brief context. Poverty in Yemen is pre-crisis. It's deep, it's structural, and multi-dimensional. And our nascent social protection programs, I say nascent because they were only 17 or 18 years old at the start of the conflict, were originally tasked with addressing the multidimensional aspects of poverty through a multidimensional mixed menu approach. So on the one hand, we had the Social Welfare Fund with the unconditional cash transfers, and then you have Social Fund for Development on the other hand, investing in education, in health, in SMEs, introducing microfinance, financial inclusion therefore, and also mobile money, and the conditional cash transfers. And the aim really being for SFD to be this transformational catalyst for society, the communities and the individuals that we serve. Now, the subsequent humanitarian response that scaled up after 2015 was more process-led and not really transformational by design. So focusing on how many people received support over how many people went on to be resilient. Or not living that transformational experience. So I believe that locally led social protection programs, such as the Social Fund, can drive transformational design and resulting in improved linkages with humanitarian cash. And I think we can do that in three ways that I'd like to discuss today. And the first is a bigger focus on human capital. The second is bigger efforts on transforming systems, for example, being more shock responsive. And third, sustaining the transformation by working with, and this is really important, we can't do it alone, working with the international community to win national and local support for more effective social protection systems. So think about revised social contracts. So there's a political dynamic question there. And this third point, I think, is the most challenging, and so I'd like to begin here. So in some ways, it's the elephant in the room. Social protection programs are born out of social contracts between citizens, and as Justine said, residents and the state. And we also realize that at particular critical junctures, programs evolve. So the report mentioned in 2011, Libya added new categories of beneficiaries, predominantly youth. And in Yemen, the social registry grew by about 50% in 2011 and was about to grow further by around 400,000 individuals just before the war in 2014. So why I raise this is that I see Yemen coming to another critical juncture, which is the potential peace talks. And I see that as an opportunity really to lay the grounds for a social contract that supports more effective social protection programs. And I think local organizations, such as the Social Fund, with the support of the international community and civil society, can inform this process for a smarter system. Now, maybe pie in the sky, maybe Wissam is a dreamer, probably true, but we can be grounded about this. So in the absence of any newly negotiated social contract, and that's still a distance, I think we can work for this longer term goal from now by proactively pursuing project-based opportunities like the referral system Justine mentioned between DRC and Social Fund, so between organizations. But we can also do it internally where we refer beneficiaries from World Bank funding to our FCDO grants for longer term support. And I think these pilots can potentially inform a new social contract for more dynamic social protection systems when our countries come out of conflict. And that takes me to my second point. Yemen's social registry system is not dynamic, it's static, it's self-contained with little or no interoperability with other systems. And I think as social protection programs, we need to start making solid strides to develop or move towards dynamic registries that can expand during crisis and contract when the situation allows. So building in the exit strategies that Justine also alluded to. So just to illustrate, we know that 20% of the social welfare funds beneficiaries and 20% of SFD's beneficiaries live in flood-prone areas. We know the size of the general population in these areas, and we know that year in and year out, disasters will hit, but we remain unprepared. Disasters hitting today in Hadramaut and in Al-Mahra. Having dynamic registries allows social protection programs to absorb and support crisis-affected populations as and when they arrive. It also means that we get a massive national capacity gain as social protection programs can begin to play an important local role in any needed national emergency response. Again, to be grounded with the sound data sharing agreements in place and the kind of adequate project design parameters like harmonization and targeting, referral systems like the one between DRC and SFD or within SFD between World Bank and FCDO can allow for longer term support for beneficiaries. So what I'm saying really is when systems, MISs are not talking, organizations can still talk to one another. And again, finding that pragmatic route is essential. And that takes me to the third point, and that's a bigger focus on human capital. And I think we can do this by providing the people we serve with a line of travel towards transformation. So just a few examples. In SFD's nutrition beneficiaries, those who already can move on to cash transfers, from cash transfers to livelihood supports, including skills training, VSLAs, asset transfers, mobile money, so financial inclusion. And some of the young women we are supporting are being offered educational scholarships in public health. They will graduate as nurses and midwives, and that will be truly transformational for them. And the most vulnerable will continue with a longer-term social assistance in a safety net model. In our casual work approach, we've introduced vocational training to improve employability, and our SME program has issued over 1 million microloans, creating thousands of jobs. Now, I mention these examples because these services at scale offer a wide line of travel towards transformation. And when we open these services up for referrals, as we're doing with DRC under our EU funding, or within and between our World Bank and FCDO grants internally, then on a project-by-project basis, we're offering space to be pragmatic. And that pragmatic space is essential for changing how we work, for improved linkages, and doing so whilst building the evidence to inform on policy. So these are the 3 points I wanted to talk about, seasoned with a little bit of pragmatism and deliberate partnerships. Thank you.
Thank you so much, Wissam, for your reflections and also from this local perspective as well. We're going to move now to Libya with Mauro. As the Libya Cash and Markets Working Group has done a lot of groundwork in mapping existing social protection schemes in the country and also different ways that cash programs can be aligned with these schemes. So from these exercises and more recent initiatives that you've done, what are some examples of good practices between humanitarian actors and governments to operationalize these linkages? And if there have been any limitations, how can some of the report's recommendations can help in addressing them?
Thanks, Mireille, and thanks, CALP colleagues, for inviting me. Well, good question. So, indeed, we did quite a lot of work in trying to map out what's out there in terms of social protection. Libya has had a very well-established social protection floor, social transfer, so everything was cash-based. We did the similar exercise. It was before in Iraq as cash working group coordinator. We did a similar exercise also there. And I want just to reflect on the point that was raised by Massimo before. Indeed, we are always looking at the social assistance. I do recognize that. And but that's as a result of the mapping, we end up focusing on linkages with social assistance, because by the time we initiate those discussions, and that's one of the key recommendations of the report, to start those discussions well ahead, well in advance. By the time we start those discussions, we end up with a very residual humanitarian caseload, which is likely to be the caseload that would be assisted under social assistance schemes rather than active labor market policies, job placement, and any other type, social insurance, and any other type of social protection system. So probably the discussion should take place before, and expertise should be brought on board by humanitarian actors at early stages, when the opportunity is still there, because then you end up with extremely vulnerable, in HRP we categorize acutely vulnerable, severely vulnerable, moderate vulnerable. We end up just serving at the end those at the very bottom of the vulnerability pyramid. So I think that's one of the issues. So we did this mapping, and indeed when we ended up identifying the basic assistance, or also called basic pension in some of the literature, as the counterpart of MPCA. In 2021, when discussion started around setting up, operationalizing the HDP, which was found its foundation, its implementation in the UNSDCF, which started in early 2023. We started to design a strategy on how we're going to align with that specific stream of assistance, which is the basic assistance. So first of all, we looked as by book at aligning the targeting models. So being a poverty reduction tool and not having as a humanitarian the opportunity to have mean tested tools, we developed proximate testing, also revised in a peer review with the World Bank, and we did it for the IDP caseload. And later on, this year actually also developed for the refugees. Using the data set of a joint research, we are still implementing together with the World Bank, WFP, and IOM with the support of the Joint Data Center. So alignment of targeting models. And it's a bit everything, you know, it was made clear in the introduction. In Libya, it's very unstable political context, so it's quite unilateral what we're doing. But there were some openings with the DERNA response. I will get there in a while. So aligning the targeting models, aligning the cash transfer values, simplifying the cash transfer values, and aligning them with what the most of Minister of Social Affairs under the basic assistance scheme is doing. Having the Minister of Social Affairs as a key counterpart. So, for example, we pushed and we discussed and we did quite a lot of groundwork with NGOs to make sure that the key counterpart, it's the Minister of Social Affairs, and not the crisis committees, municipalities, Mukhtar, and whatsoever. So centralizing in Minister of Social Affairs as the key counterpart. We know that there are some others, as the report was mentioning, but that's the institutional counterpart for social protection as an international community. And also, it seems a very simple action, but it was not easy to implement and to convince partners to have to use the booklet number, which is, if you are familiar with Iraq context, it's corresponding to the PDM number in Iraq, right? So it's the social security or family number as a key identifier. That way, at any possible given stage when social register is up and running, we would be able to share information with the government. And indeed was useful, and now I'll get to the DERNA response. DERNA response, for those that are not aware, I'm referring to a flood that took place in Libya, in eastern Libya, September 2023. An entire city was swept off by flood. There we had some opportunities. First of all, we are able to ease the KYC, doing quite a lot of advocacy, high-level advocacy with the Central Bank of Libya through the World Bank and the Department of State of US. So we are able indeed to relax the KYC requirement, which were quite strict. We signed data sharing agreements between UNICEF, IOM, UNHCR, and WFP. And we started to set up a joint cash transfer program, having a joint common information management tool, using, for those that are familiar with using UNHCR RISE Assist. Same targeting model. We set up a data application tool And we also ensured that all the agencies involved would include the piggybacking option with financial service providers when signing the contracts. So, for example, now UNHCR is piggybacking on WFP contract. IOM is also piggybacking WFP by themselves. They are doing another tender with a piggybacking option, which means we'll have a broader array of easy, ready to be used solutions as we move ahead. In terms of relations with the authorities, again, with the DERN response, there were some openings. So we were able to get an agreement with the Minister of Social Affairs to do the distributions and the allocations, for example. We coordinated on data application because the national authorities, they had in place rental subsidy scheme, compensation schemes, basic assistance schemes for those affected by the flood. So we're able to coordinate and making sure that those that are receiving the humanitarian assistance wouldn't get, for example, the rental subsidy or the other way around. So that's a bit on the first part of the question. I think I still have a couple of minutes to go to the second part. Okay. Limitations. I mean, the report talk by itself, right? Political instability. The day before yesterday, the special representative of Secretary General resigned from his function, as you might heard. That gives you an understanding of the political instability of the country. So that's from a political perspective. I will not go in details. Humanitarian actors indeed are perceived as agents of foreign countries. It was made clear in the beginning. We still have a persistent liquidity problem, so there is no physical cash, and which on the other side gave the opportunity to Libyan companies to set up different ways of digital methods of payment. So that's quite spread right now. Have mobile money, prepaid card, gift cards, and so on and so forth. Still, there is a bottleneck with the non-Libyans, at least non-Libyans with no recognized IDs, which is the majority of non-Libyans, not only refugees, but also migrants. About 700,000 migrants in Libya, about 50,000 refugees. Just a small part of them has a valid or recognized ID. So I would second the recommendation that was made in the report and also reiterated by Massimo in the beginning, that we should look indeed at other bits within the array, with the spectrum of social protection, especially looking at labor protection. Policies. I know that there are some initiatives by IOM within the cooperation framework, which looks indeed, as it was reported in the report, looks indeed at regularizing working relations in Libya. So from UNHCR perspective, it would be achieving protection by labor protection, which is quite solid. The other very good point in the report was about the lack of a consolidated forum. It was also reiterated by other panelists. A consolidated forum where discussions around social protection can take place. We had a number of initiatives here. We had Social Protection Forum. We had another initiative led by UNICEF and UNDP. Then we had another initiative led by a governmental actor, the National Economic and Social Development Board. We now have a work stream under the UNSDCF. I know about another initiative from IOM, WFP, and UNICEF, but indeed there is not a single forum where both humanitarian development and governmental counterparts are sitting together. I'll stop here, and thanks for the time.
Thank you so much, Mauro, for also sharing these operational examples. I think that they are great. Now we will move to Iraq with Igor from ILO. But first, I would like to also remind you that you can already drop some of your questions in the Q&A box. So some of the panelists can start also replying to these questions, as I'm afraid that we will not have a lot of time dedicated for an open discussion on questions and answers. So moving to Iraq, Igor, what are some of the lessons learned from the coordination between the UN agencies, the government, international and local NGOs, and what worked well and what did not work well? Igor, I think that we cannot hear you.
Can you hear me now?
Yes, perfect.
Okay. Just a second. Okay, so thank you very much for having invited me. I would like to start by saying that I fully agree with what Massimo was saying, also Justine was saying regarding how social protection is much wider than just social assistance, and also the need to see social protection as a universal right. Of course, for ILO, this is very important. Now, looking into what are the lessons that we have learned, as you might have heard, the government recently passed a new social security law for the private sector, and there was quite a bit of outreach to different types of stakeholders around the country to make sure that passed, the law would be passed. So in terms of the type of collaboration that was necessary for that, I think what really worked well was understanding the fragmented nature of the of institutions and the political sensitivities in each institution, and being able to tailor messages that were basically meant to convince each of the different stakeholders that it was important to support such a universal approach for social security in the private sector. And so in particular, we had a lot of outreach with the parliament that was more successful, I would say, than the initial engagements we had with the Ministry of Labor. Although with the Ministry of Labor, we have also we developed a lot of, we had to work very closely with them as well. So in the end, it really took almost, I would say, almost a year and a half of advocacy efforts with workshops throughout the country to reach the point where this law was passed. Now, in terms of what the challenges were, I think the challenges are really all about the implementation of this law, because even though we're already 5 months after the entrance into force of this law, the instructions haven't been issued yet, and the details about how to access the Social Security benefits are pretty much unclear as of yet. And so we're trying to see how we can cooperate as much as possible with different stakeholders, including, of course, ILO constituents like trade unions and the employer organizations, as well as NGOs, to see how basically we can expand the coverage for Social Security. So that's one point. Now, I would sort of like to also highlight the importance of ILO's Employment and Decent Work and Peace and Resilience recommendation of 2017, because it does give quite a few guidelines as to how to operate, particularly from the perspective of implementing a social security insurance program in a country like Iraq. And so that's one thing. The other point, I think, is that what would be interesting in trying to develop further cooperation would be to see how we can cooperate further with different organizations in extending coverage of this new social security law, particularly to more vulnerable populations, including migrant workers, IDPs and refugees. Right now, the government is still developing the instructions for the law, so we'll see how what the procedures will be to register. For some of the benefits, of course, the procedures will be rather simple and straightforward, like what was there before for the pension system, which still is now still valid. But for the new benefits which are covered in this new law, including unemployment insurance, maternity leave, compensation, and health insurance, and so on, it'll be much more complicated because the details of how this is going to be worked out are still being worked out. The other point, which is also very important in trying to is basically cooperation at this stage in expanding public employment programs, because public employment does offer basically a means of social protection for those who are working, and it also employs people. And so we're right now developing we launched a new program to basically help the government come up with a framework to develop public employment policy in the country. And in terms of potential ideas that could help in the future, maybe to link cash assistance with Nexus, it would be basically, I think the idea of a social pension would be important, particularly for those who are not covered by contributions to the social security system. So that would allow those who are not working effectively and who need to have some type of universal protection. So those are just a few ideas, and I welcome any questions you may have from your side. Thank you.
Thank you so much, Igor, for sharing your ideas. And thank you, everyone, all the panelists, for all your contributions and reflections today. I'm going to hand it over now to Annette. She's the Cash and Humanitarian Advisor at global level with People in Need, and she's also co-chairing the Regional Community of Practice of Linking Cash with Social Protection. We will have a few minutes for questions and answers, so over to you, Annette.
Thank you very much, Mireia, and thank you, everyone, every one of the panelists. It was super interesting to hear your thoughts and answers to your questions. So we do have 5 minutes for Q&A. I saw that there was a question in the Q&A box that was already answered. That was for the World Bank and Yule. But I would like to ask if there is any other question. You can just raise your hand and we will authorize you to unmute yourself for any of the panelists, or even just like a final remark or comment. Okay. I don't see anyone with his or her hand raised at the moment. So I saw that there was a comment in the chat before, actually, like earlier, from Rahul. asking whether these recommendations, the recommendations in the report, were validated by duty bearers themselves, and if there is interest among the duty bearers in engaging with civil society organizations to take the recommendations forward. And I saw that this was answered by Rana as well, kind of opening up for thoughts and for addressing like any comment you might have with this regard to like us, as we want to keep moving these conversations forward. So it would be great if you have like specific ideas on how to operationalize the report, or like how to keep moving the conversation forward as well. And I see that there is a hand raised from Igor, please.
Yeah, no, just to follow up on what I was saying, I think in 2 weeks we're going to be having a sector-wide coordination group in Erbil on social protection, and anybody who is interested is welcome. I mean, we could just let me know. The invitations will be going out from UNICEF, and as part of this joint program between ILO, WFP, and UNICEF. But let me know if you're interested, and we can make sure you can join online.
Brilliant. Thank you very much, Igor, for sharing this opportunity. It sounds very interesting. And Rana also shared her email address in the chat in case you want to reach out bilaterally on any of the points discussed up until now. So I don't see any other hand raised, and we are actually at 28, which is what we were we scheduled for the final remarks and closing. So I would just thank everyone and hand it over to Rana for the closing remarks. Thank you.
Great, thank you, Annette. And yeah, thank you very much again to Abdullah and Beyond Group Consulting, and to all our brilliant panelists. I mean, I'm scribbling so many notes, so many things to think about and follow up on. And really this, we wanted to make this report as practical as possible. So there's still definitely a lot more to do on kind of looking at the uptake of some of the recommendations. So yeah, just a big thank you. And if anyone wants to join the communities of practice, I put the link in the chat. Just scroll down to the MENA communities of practice, and the specific one on linking humanitarian CVA with social protection. And yeah, we hope you enjoy delving into the report if you hadn't had a chance yet. So again, big thank you for our panelists' times, and for everyone who joined us today. And we hope you have a good rest of the day and a good weekend if tomorrow's off for you. Take care, everyone. Thank you.
Thank you. Thank you.
Bye.
Bye, everyone.
Thank you.
Thank you.
Thank you very much.